So in order to help you improve your communication skills, I want a new photograph now from this side so that you capture all these massive things before we go. Because where we took the photograph was showing only one cheek of the hospital. So before we go, I will invite the VIP team to come here and then they capture this very impressive structure. As the General Dr. Silva has briefed us, if you want to die, you will die here. Any cause of death, you are welcome here. Instead of going to die in India and then you say you bring back when you are dead, no. Everything is here. So if it is cancer, there is a room for you. If it is, you are talking of cardiology, there is a place for you here. All the branches, he talked about them, EMT and so on. So I think this is very good for the army, but also for the country. So I thank everybody who was involved in the planning and in the execution. Now we don't have much to do. It is to wait for you said it's now 80% ready. Dr. Msiru said that they are now going to start putting the equipment. I don't know whether the equipment is the 20%. So the civil works are finished. You see,
so the 80% is the construction works.
Civil works.
Civil works. Then equipment, the bidding process is going on.
Okay. So the 80% complete is the civil works.
Civil works.
Okay.
But fortunately, most of the fittings are already here. Yes, sir.
Okay. So thank you so much. We have nothing. It's good that you made it part of the Tarehe Sita celebrations, because this has been a long-standing program for the armies of Uganda. They have never succeeded in having a military hospital. And as you know, in many parts of the world, military hospitals are the top end of medical care in countries. I think, if I'm not wrong, when President Trump got himself corona, because he was looking for it most of the time, when he finally got corona, I think he was taken to Walter Reed Military Hospital. Is that not so? They didn't take him to all the other hospitals. They took him to this, I think it was called Walter Reed Military Hospital. So that shows you, and he was cured. He was cured by the new experimental drugs which they applied on him. So I congratulate you, and I wish you good luck in completing the remaining, so that we have a fully functional military hospital. Now, I don't know the planning, but how you will get money from these rich Ugandans, these businessmen who have got all sorts of problems. Will they pay or what? Will you allow a paying will? Somebody brief us on that. The rich men who want to pay. Dr. Mbon, you want to tell us?
Thank you very much, Your Excellency. We designed it in such a way that it will be a private company and will be serving the public as well, the private patients. And the prices will also be calculated in such a way that most of the people locally can afford to come in.
Okay.
So yes, they will be paying, but we shall make sure that the costs are affordable.
So the military free?
There will be a provision, Your Excellency, within the defense budget to make sure that there is continuity of treatment by providing what would have otherwise covered them elsewhere. So there is continuity in the management of the running of the hospital.
So if I'm a soldier and I'm sick, I come here, I am treated free?
Yes, sir.
But for the rich people in the town, they pay?
Yes, Your Excellency.
That's real Christianity and Islamic arrangement. Thank you so much. I wish you good luck, and I insist on my photograph from, I think, from south to north direction. Thank you.
I want to thank Your Excellency for those remarks. I think the whole group will have to join in, all the ministers, the permanent secretaries and the contractors, and it is encouraged.
Yes, thank you so much for watching. We are at Mbuya Military Barracks, and His Excellency Yoweri Kaguta Museveni has just been speaking to the people here after, commissioning this military hospital in Mbuya, and right now he's going to have a group photo with the top military council. I'm saying the Minister for Defense and Affairs with him, the First Lady Janet Museveni. I'm saying the Minister for Presidency, Sita is also around, and the Permanent Secretary, Minister of Health, Dr. Dana Twine. Yes, what you're seeing on your screen is a group photo of His Excellency the President and the Commander-in-Chief of the Armed Forces, General Yoweri Kaguta Museveni. Besides him is the first Deputy NRM Chairperson, Alhaji Moses Kigongo. We have the Minister for Presidency, Esther Mbayo. We are seeing the First Lady, Janet Museveni, and other staff from the Ministry of Defense and Veteran Affairs. Right now, the President is heading to Mbuya, UPDF headquarters, where the official celebrations for Tarehe Sita celebrations are going to be taking place. From here, we are going to be coming back to you shortly as soon as we reach Mbuya headquarters.
With increased peace both in Uganda and around the region, and a successful professionalization program, the leadership of the army set out to put the disciplined forces to more services to the nation. Health and education has been one of the areas that the UPDF has really been exceptional. With country's medical response being crucial to the people's survival, the UPDF has always been ready each time the country has needed them. Just recently, the UPDF responded swiftly when the COVID-19 pandemic hit.
Contribution has been immense. We've had the responsibility to look after our own, because it's a huge constituency of prevention of the force and protection of the force against COVID, but also managing those cases that have been unfortunate to contract COVID. We've contributed personnel. We have also been put on standby, like we are now in a communal transmission stage as possible fallbacks if the national facilities are exhausted.
UPDF was invited by the Minister of Health to come and support Mulago, and it is our constitutional mandate to support the nation in terms of when there is a catastrophe or any disaster. So we swiftly mobilized and moved in to support Mulago Hospital. For us, because of foresight of our leadership, we saw this coming. When we had the first case in Egypt, we said now the African continent was affected. So we requested to be trained, and we trained 86 medical workers, both at Mbuya and Pombo.
COVID-19 is just one of the responses.
I commend the UPDF team for having really worked harmoniously with the entire team. I think my team, you can attest to that.
So we are much wiser and more ready to fight COVID in whichever form it comes. I think every institution that is involved, be it the Minister of Health, be it immigration or security, surveillance, we are kind of, at the moment, we can say we're on top of the situation.
During the Tarehe Sita celebrations, the army usually goes into communities to promote cleanliness and educate the public on how to avoid diseases such as cholera. The Mbuya Military Hospital is indeed the rising sign of an army fully involved and decided on contributing strongly to the good performance of the country's health sector.
As part of our doctrine, one of the functions is cooperation with the civilian population, and one of the ways we relate with the people is through attending to their medical aspects. Wherever we are, people come to our clinics, to our hospitals for free medical treatment. Sometimes the numbers we treat from the population compete with the numbers of the service people. So that is one of our dealings with the population.
Located up on the Mbuya Hill, the 250-bed Mbuya Military Hospital will be a public partnership facility at National Referral Hospital standard to offer the best to all patients and cases that will be referred there both from the civilian and army circles.
Mbuya Military Hospital is a referral facility. We have level 2 hospitals in our mainly brigades and divisions. We have Bombo, which is like level 4, I think, in medical speak. So we needed a facility with specialized services for our personnel. But also this would be available for the population, but on payment terms.
It is services and facilities like those that the Army proudly associates with during the time of peace.
but also it will be available for services that are otherwise not easily available and for which we usually have to spend overseas by referring people. So we are domesticating specialized services in this referral facility for our rank and file, but also making it available to the population.
Even Red Cross, which usually joins the Army at front lines, now is with the Army at the front line of health and fighting against diseases.
What drug is this?
Apart from contributing to the health sector, the UPDF has immensely contributed to the education sector by setting up education institutions, right from primary to institutions that handle senior officers.
We've done a number of schools. And some of our schools, like in Masindi, in Entebbe, have been some of the best performing schools at primary and also at all and advanced level.
At the end of the war, the Army had many young soldiers, popularly known as Kadogos. To fit into a professional outfit that the Army leaders desired to have, these young soldiers had to be sent to school. Bombo Army Secondary School is one such school.
But I also later went to study and attained a master's degree in business administration. Yeah? So I encourage you to work very hard.
But it has not been a smooth journey for the Army to run the education sector.
We used to have free Army boarding primary and secondary schools across the country. But because of cost, we had to fall back to have mainly day schools, primary and secondary, because feeding, accommodation had a huge bill. And it was, I think, abused because people used to bring in relatives, friends, and most of these were civilians, not service personnel dependents. So we folded back to retain the service, but also make it easy to handle.
It does not just end with secondary schools. Senior officers now attend tailor-made courses at different staff colleges in the country. This helps in sharpening the officers in leadership capabilities.
3 years, you not only do military training, but also you enlist for a university degree in security studies. So we now have Kabamba, which is cadet school affiliated to Makerere for that degree, like Chimaka is the staff college.
With the forces now getting the medical and education issues right, one can confidently say the UPDF is on the right track to strongly contributing to combat against the two most dangerous problems Uganda has faced over time: disease and ignorance.
Double data. Airtel introduces double data, the biggest deal ever on smartphones in Uganda. Buy a smartphone, 3G or 4G, and get 100% data bonus from Airtel. Airtel is giving you 100% bonus data on all weekly and monthly bundles for every new smartphone connected to Airtel for the first 3 months. Dial *175*9# to enjoy double data. Double data, double data. Oh, bino bye biruma bayaye. Airtel, the smartphone network, regulated by Uganda Communications Commission.
The Electoral Commission concluded local government councils elections countrywide for city, district chairpersons and councillors, municipality and city division chairpersons and councillors, councillors representing special interest groups to district, city, local government councils and sub-county, town, municipal division chairpersons and councillors. However, some electoral areas in different parts of the country were not able to conduct or conclude the elections due to various reasons. Accordingly, the Electoral Commission has appointed Monday, 8th February 2021 as the polling date for the conduct of residual local government councils elections in the affected electoral areas across the country where the said elections were not conducted or concluded.